Stimulant use disorder represents a significant and growing public health concern that affects millions of individuals worldwide, encompassing problematic use of both illicit substances like cocaine and methamphetamine, as well as prescription medications such as amphetamines used to treat attention deficit hyperactivity disorder and narcolepsy. This disorder is characterized by a pattern of stimulant use that leads to clinically significant impairment or distress, affecting an individual's ability to function in work, school, relationships, and other important areas of life. Unlike some other substance use disorders that may develop gradually over years, stimulant use disorder can progress rapidly due to the intense euphoric effects and powerful reinforcement properties of these substances. The landscape of stimulant use has evolved significantly over the past decades, with methamphetamine use reaching epidemic proportions in many regions while cocaine remains a persistent problem in urban areas. Prescription stimulant misuse has also emerged as a concerning trend, particularly among students and young professionals who may initially use these medications to enhance academic or work performance before developing problematic patterns of use. The diversity of stimulant substances and their varying routes of administration create unique challenges for prevention, treatment, and public health responses. Understanding stimulant use disorder is crucial as these substances can cause severe physical and psychological consequences, including cardiovascular complications, psychosis, and significant social and legal problems that can devastate individuals and families. Neurobiological mechanisms and brain effects. Stimulants exert their powerful effects by dramatically altering brain chemistry, particularly within the dopamine system that governs reward, motivation, and movement. These substances work primarily by blocking the reuptake of dopamine, norepinephrine, and serotonin, causing these neurotransmitters to accumulate in synapses and creating intense feelings of euphoria, increased energy, enhanced focus, and heightened alertness. Cocaine blocks dopamine transporters directly, while amphetamines both block reuptake and reverse the direction of dopamine transporters, causing an even more dramatic surge in dopamine levels. This flood of dopamine in the brain's reward circuit creates reinforcement signals that are far more intense than those produced by natural rewards, making stimulants extremely addictive. The neurobiological impact of stimulants extends beyond the immediate euphoric effects to cause lasting changes in brain structure and function. Chronic stimulant use leads to significant alterations in the prefrontal cortex, the brain region responsible for executive functions such as decision-making, impulse control, and planning. These changes help explain why individuals with stimulant use disorder often continue using despite clearly understanding the negative consequences of their behavior. The dorsal striatum, involved in habit formation and compulsive behaviors, also undergoes significant changes that contribute to the compulsive nature of stimulant use. Repeated stimulant use causes the brain to adapt by reducing natural dopamine production and decreasing the sensitivity of dopamine receptors, leading to tolerance where increasingly larger amounts are needed to achieve the same effects. This neuroadaptation also results in severe dysphoria, depression, and anhedonia during periods when stimulants are not being used, creating a powerful motivation to continue using to avoid these negative emotional states. The rapid development of tolerance and the intensity of the crash following stimulant use create a cycle of binge use patterns that are characteristic of stimulant use disorder, where individuals may use continuously for days or weeks followed by periods of exhaustion and depression. Clinical presentation and diagnostic features. Stimulant use disorder manifests through a constellation of symptoms that significantly impair an individual's functioning across multiple life domains. The diagnostic criteria focus on patterns of stimulant use that cause clinically significant distress or impairment, including impaired control over use, social impairment, risky use, and pharmacological effects such as tolerance and withdrawal. The presentation of stimulant use disorder can vary significantly depending on the specific stimulant being used, the route of administration, and individual factors such as genetics and co-occurring mental health conditions. Impaired control over stimulant use often becomes evident through binge patterns of consumption, where individuals use stimulants continuously for extended periods, sometimes staying awake for days at a time before crashing into prolonged periods of sleep and depression. During these binges, Individuals may consume enormous quantities of stimulants, far exceeding any intended amount, and find themselves unable to stop despite mounting negative consequences. The intense cravings associated with stimulant use disorder can be triggered by environmental cues, stress, or emotional states, leading to seemingly impulsive decisions to use that override rational decision-making processes. Social impairment from stimulant use disorder can be particularly severe and rapid in onset. The hypervigilance, paranoia, and erratic behavior associated with stimulant intoxication can quickly damage relationships and social connections. Individuals may become isolated and suspicious of others, leading to the breakdown of family relationships, friendships, and professional networks. The financial costs associated with maintaining stimulant use can be enormous, leading many individuals to engage in illegal activities, sell personal possessions, or neglect basic needs such as food and housing to obtain drugs. Employment problems are common, ranging from decreased productivity and absenteeism to termination due to erratic behavior or positive drug tests. Physical and mental health consequences. The physical health consequences of stimulant use disorder are severe and can be life-threatening, particularly affecting the cardiovascular and central nervous systems. Stimulants cause dramatic increases in heart rate, blood pressure, and body temperature, placing enormous strain on the cardiovascular system. Even young, otherwise healthy individuals can experience heart attacks, strokes, and cardiac arrhythmias during stimulant use. Chronic stimulant use can lead to cardiomyopathy, a condition where the heart muscle becomes weakened and enlarged, increasing the risk of heart failure. The vasoconstriction caused by stimulants can also lead to tissue death in extremities, and in severe cases, individuals may require amputations due to compromised blood flow. Neurological complications from stimulant use include seizures, which can occur even with first-time use and can be fatal. Chronic methamphetamine use, in particular, is associated with significant brain damage, including loss of gray matter in areas associated with emotion and memory. This brain damage can result in cognitive impairments that persist long after drug use has stopped, affecting memory, attention, and executive functioning. Hyperthermia, or dangerously elevated body temperature, is another serious risk that can lead to organ failure and death, particularly when stimulants are used in hot environments or during physical exertion. The mental health consequences of stimulant use disorder are equally concerning and often persist well beyond the acute effects of the drugs. Stimulant-induced psychosis is a common and frightening complication that can include paranoid delusions, hallucinations, and violent behavior. These psychotic episodes can last for hours, days, or even weeks after the last use, and may require psychiatric hospitalization. The paranoia associated with stimulant use can be so severe that individuals become convinced that they are being watched, followed, or plotted against, leading to dangerous and unpredictable behavior. Treatment approaches and recovery challenges. Treatment for stimulant use disorder presents unique challenges compared to other substance use disorders, primarily because there are currently no FDA-approved medications specifically for treating stimulant addiction. This absence of pharmacological interventions makes behavioral therapies the cornerstone of treatment, though research into potential medications continues, with some promising developments. The intense psychological dependence associated with stimulant use disorder, combined with the severe depression and anhedonia that characterize withdrawal, creates significant obstacles to achieving and maintaining abstinence. Behavioral therapies have shown significant effectiveness in treating stimulant use disorder, with contingency management being particularly successful. This approach uses positive reinforcement, typically in the form of vouchers or prizes, to reward abstinence and treatment engagement. The immediate tangible rewards help counteract the brain changes associated with stimulant use that make it difficult for individuals to focus on long-term benefits of recovery. Cognitive behavioral therapy helps individuals identify triggers for stimulant use, develop alternative coping strategies, and change thought patterns that contribute to continued use. The Matrix model, specifically developed for stimulant use disorders, combines multiple therapeutic approaches including group therapy, individual counseling, family education, and relapse prevention training. Managing the acute withdrawal and early recovery period requires careful attention to the severe mood symptoms that characterize stimulant withdrawal. While stimulant withdrawal is not typically medically dangerous like alcohol or benzodiazepine withdrawal, the psychological symptoms can be overwhelming and contribute to high relapse rates. Depression during early recovery can be so severe that individuals may require psychiatric intervention, and some may benefit from antidepressant medications, though these must be used carefully in individuals with a history of stimulant use disorder. The treatment of co-occurring mental health conditions is crucial for successful recovery from stimulant use disorder. Many individuals with stimulant use disorder have underlying ADHD, depression, bipolar disorder, or trauma-related conditions that require specialized treatment. Integrated treatment approaches that address both the stimulant use disorder and co-occurring mental health conditions simultaneously have shown better outcomes than treating these conditions separately. For individuals with ADHD who develop stimulant use disorder from prescription stimulants, treatment may involve switching to non-stimulant ADHD medications or implementing enhanced monitoring and support systems. Recovery from stimulant use disorder often involves rebuilding multiple aspects of life that may have been damaged during active use. The paranoia and erratic behavior associated with stimulant use frequently destroy relationships, making family therapy and relationship repair important components of recovery. Many individuals face legal consequences from their stimulant use, requiring coordination with the criminal justice system and legal advocacy. Employment and housing instability are common, necessitating vocational rehabilitation and housing assistance services. Long-term recovery maintenance presents ongoing challenges due to the persistent changes in brain reward systems caused by chronic stimulant use. Many individuals in recovery report persistent anhedonia and difficulty experiencing pleasure from natural rewards for months or years after stopping stimulant use. This creates vulnerability to relapse, particularly during times of stress or when exposed to environmental triggers associated with previous use. Support groups, both traditional 12-step programs and newer alternatives like Smart Recovery, provide ongoing peer support and practical strategies for maintaining abstinence.